Hi everyone, welcome. We are happy to have you join us today. Today we will be joined by Dr. Tony Myers. Dr. Myers is Mercy's Vice President of Systems Quality, Risk, and Medical Affairs. And he will be talking to us today all about COVID-19 and how to celebrate the holidays safely. We all know that that has been a concern, especially with the cases rising in the past 3 weeks. So we're very grateful to have Dr. Myers here today. There will be a time for questions after. So thank you for being here, and I will turn it over to Dr. Myers.
All right, thanks for having me. I hope everybody's staying safe and well. The comment about the CMO's discussion about protecting the family in the hospital, that's a really great way of putting it. I was on the radio this morning with WMT. We've been doing lots of, people may see, we've been doing jointly with Unity Point press conferences and appearances on the TV stations and public service announcements that, and what you say is true. This is, since we don't have any true policy changes anticipated, then we have to just, appeal to the greater good, appeal to our better angels, so to speak. And that's what we're forced to do right now. I wish I had better news, and I think people are aware of this. And I did not get to see the governor's conference, but I'll watch it later. Here in locally and across Eastern Iowa, over the last week specifically, the cases both in the community and in the hospitals have increased dramatically, essentially doubled, is an easy way to think about it. And while the hospitals still have capacity, once you get to that point, even with surge, even if you just look back at our staff over the last several months, most of our nursing staff is working at about 120%. They have been doing that for a while, since June. And so you kind of think about the toll that takes on you over time, and then to have it increase demands is really an unsustainable model. So at some point you have to redistribute staff if you have them. We were just having a conversation with the CMOs in Iowa City and Southern Iowa just before I came on this call, talking about what if one or two of our critical care doctors goes down. I mean, there are some relatively large hospitals that have two. So all sorts of things we're working with, trying to, set up kind of telemedicine support with intensivists and other places, and utilizing staff, medical staff in ways to support the pulmonologists, like the critical care or the interventional cardiologists, and then some of our interventional radiologists to help offload some of the actual practical work that they do in the intensive care unit, just so they can use their mind more than anything to help guide therapy. We are much better at taking care of COVID than we were when this whole thing started. And so that's good, but there's still a significant portion of the patients. So right now, sitting here, we have 29 active COVID patients in this hospital. Again, that's about double what we were seeing for a long period of time. Of those, 7 are critically ill. 3 of them are on ventilators. And then in addition to that, we have what would be our routine critical care population. I think we have 9 in the hospital right now. 16 critically ill hospitals in a hospital this size is stressful for the staff. It's sustainable, but it's stressful. But with the idea of that going to 26 is an unsustainable thing, unless we would pull staff from other places, and even then you could start to get short. Which goes to the second thing, and then I talked about this on the radio and at the press conference, they brought this up too, the family of the healthcare workers. What's making this different? It was a concern early on that our staff was going to get sick because of what had happened in other countries. It was a big concern, but it didn't happen. And now it's happening. It's happening because since it's all over the community, invariably we have 3,000 staff in this system, and they live in the community. And so a significant portion of them are getting ill. Mercy as it stands right now, we've always been tight and very good at communicating protection of our staff to themselves and their families. So we're in a relatively good spot compared to other hospitals in Eastern Iowa, but we don't fool ourselves in thinking that that's going to continue. Right now, today, we have 40-some staff out positive. Now, that's across 3,000 people scattered everywhere. That's not just critical care or nurses. And in fact, knock on wood, most of our critical care staff is healthy, but it would not take much to devastate that. So that, with all of that talk, we continue to communicate how much we appreciate our staff. Our staff really work well together. They work extra shifts and they support each other. And so we really support them. I know our chief nursing officer, Mary Brobst, went up a couple weeks ago. One of the things that's really hard if you have deaths, and we've had some young people die, and that's super hard on the bedside nurses. That just tears them up. And so she actually went up there and worked for a day just side by side with them, just to show that kind of support. It wasn't like they necessarily needed the extra hands, but trying to be there for moral support. So that's where we are now. Thanksgiving is very soon. And there's no way that I can say in good conscience, based on the spread that's happening right now, that any high-risk person should do anything that could potentially expose them. It's a tough thing, and we're all tired of this. But we're in a different spot now. It's 3 weeks ago, I would have said something a little different. Be careful in this way. Separate. Make sure you wear a mask. Make sure everybody wears a mask. We're in a different spot now. People should not be doing it. And what we see in the people that are getting admitted to the hospital, it's small family gatherings or small friend gatherings. It's going over and watching the football game. It's going, I can't tell you how many, even small weddings, small funerals. That's where we're getting the spread. And those are tight groups. Those are, your family. And it's just tough, but that's where people are getting it. So I can't say honestly that there is any safe way that to spend time in the same room unless your family isolates. I have had a couple of patients tell me that their family, they're going to go visit one set of a kid and his wife, and they are isolating for 14 days before they go there. And you're putting a lot of trust in that, and we're all fallible. So we're bringing in that risk. So I mean, if I can try and make somebody feel better, I'm going to open it up to questions. If you have a plan of your own to try and be with family, I can try and help optimize that. But if patients are asking me right now and I'm telling them don't go. So I'm open for questions.
And do you have any, not that you have a crystal ball, but followed shortly after Thanksgiving is Christmas.
I know.
And so hopefully it doesn't increase and it decreases, but what I'm hearing is that this is a really tense time. And if we care about our workers in the hospital and ourselves as a high risk person, that we just abandon some of the things that we've done in the past.
Yeah, I think you just have to do things by video. You just do. Luckily, we have that. That's something. Yeah. But I agree. We are at a really, really concerning time. And if you think about, we have continued to have what we call our mini incident command pretty much every day since March with the executive staff. But just so the group understands this, over the last week, we started to have big high-level conversations across Eastern Iowa. But then internally, we've started, we're dragging out our doomsday plans that we created in March, and we're having the whole group of director level leadership meet every morning for an hour to start parsing through when we get to 37, when we get to 45, when we get to 50. That's the kind of thing, that's where we're at. And believe me, we would not be doing that if we didn't seriously think that it's a possibility. we think that we may have to surge and create extra space and surge staff around to unfamiliar places as soon as this weekend, depending on what happens.
So if there's a family that is low risk, young and you know, no health issues, is it safe for them to get together?
It's, well, it's safer. So here, as an example, unfortunately, they may still stress the hospital some, but honestly, well, I mean, this is hard. We've had a 28-year-old death. We had a 31-year-old that was on a ventilator for 4 weeks and did eventually recover and leave the hospital after about 6 weeks. So young people do have risk. It's clearly not as much to get severely ill. The other thing is that if they come to the hospital, a couple of nights ago, we admitted 5 patients that were in their 30s. But the good part of that is most of them are now discharged from the hospital. So they were here for a short period of time. I think, you know, if you have a small young, well, I mean, it depends on kind of what you describe as family. I assume people are in their own little pods in their family now. I assume you're talking about other families sort of coming together, the young people or the lower risk people all coming together. And that's safer than having the high risk people there. But given the amount of spread, it's still, there's a possibility. Again, that's where a lot of these hospitalizations are coming from. Of the people that are lower risk, I mean, you would be considered a lower risk type of person. They're still getting, a lot of them are getting sick enough to come to the hospital, at least for a few days. But that's a lot better than a month.
Thank you.
Yeah.
I know that there are new drugs since March. Are those drugs in plentiful supply or are they being rationed out?
That's a really good question. And, you know, everybody knows, thinking back to all the supply issues that we had with protective equipment and medication supplies and, you know, and testing supplies, that was a big one too, right? So all of that stuff got a lot better. And to answer your question quickly, today, we're good with medicine supplies. But what we've started to see, so for a long period of time, we actually finally got enough tests. You know, we finally did. This has probably been in the last month and a half or so. And then, you know, finally we're getting sort of comfortable with PPE and getting steady drug supplies. So the problem now, interestingly enough, although we're in an okay place right now with this surging in cases, we're starting to actually see a little bit of that flare back up, which makes sense. So even though we had gotten to a point where we were okay and comfortable taking care with a certain number, 2 or 3 in every day, 2 or 3 out every day, we're in a much different spot now. And so as an example, all of a sudden, and this has kind of been a little bit of a concern all along, just gloves, sterile gloves, exam gloves. That's I heard this morning. This is potentially a huge issue, and it makes sense because now everybody is using more stuff because we have more sick people, and so certainly something we watch every day with all of these supplies. And you do kind of wonder if we continue to see this level of cases that we will start to have some supply issues again across the board, testing, protective equipment, and medications.
What's your thought about vaccine and the sort of realistic way that vaccine is going to go?
Interestingly enough, I was on a call yesterday with the Iowa Department of Public Health. Since Mercy is a really strong institution as far as leadership and anticipating and planning goes. When we started talking about the vaccine a couple of months ago. We knew the types of vaccines that were out there, and you've heard this probably, is one's going to require ultra cold storage capacity. So we ordered a freezer and we got it up and in place, and there's all sorts of rules and regulations and equipment you need to monitor that. So it turns out on the call yesterday, we're only one of 6 places in the state that have the ability to store the vaccine. And the reason why we were called was because the federal government is going to try and pre-position vaccine even before it's approved, or no, it's right when it's approved, but it hasn't actually been vetted as far as you know, how you give it and when you should give it. There's an organization called ACPI or ACIP that's a federal organization that oversees basically the education around all of vaccination. So even before that group looks at it, they're going to pre-position vaccine in places across the country, and we'll be one of those places. So as soon as there's an emergency use authorization, which could be by the end of this month, with this particular vaccine that's coming from Pfizer, that we should actually have it in the hospital and ready to give once we're given the instructions on actually how to give it. And so that's reassuring to me. It's where that will really help us early, because hospital staff, especially clinical staff, are going to be number 1 on the list of people to get it. That will help from that other thing that we're all worried about now, is losing all of our staff. We still need it to go, the incidents to go down in the community, but that will be a big weight off our shoulders if we're pretty confident that most of our staff is protected. So I anticipate that hopefully, again, like I said, we may be one of the first places in the state that have it on site. Once we get it, potentially by the end of the year, within the next month, that we would be vaccinating our staff. That's kind of best case, but also not an unrealistic view of it. Now, as far as then the next wave after we get through the nursing home and the hospital staff will be elderly people, and it's kind of hard for me to predict what's going to happen with that, and when you know, best case scenario, potentially January or February, where we'd start to have more mass vaccination clinics, especially for higher risk people. And then at latest, I would be extraordinarily surprised if it would be any later than April, but possible. So it's we are to the point again. We started off this conversation talking about what we can do to decrease the spread. We obviously, if somebody can find a cure for it, that would be awesome, but it's not going to happen. The medications help, but they're not cures. So we are dependent on that vaccine. We need that vaccine, and the sooner we get it, the sooner that we can go back to normal.
What is your confidence level in the vaccine that's coming out?
I'll have to see it. So what confidence I have is based on the studies that were published in regard to early on in the small trials. And so it's both based on this is a different type of vaccine. It's a genetic vaccine as opposed to a protein vaccine. Most vaccines that we've had forever were based on some piece of the infectious agent, like a piece of measles or, you know, a piece of the smallpox virus. And so they're doing this in a different way. They're creating genetic material so that our own body will make that protein as opposed to being put in. So there are several advantages to that. One is that the production of it should be much quicker. And that's one of the reasons why it's coming to market so much quicker. The other one is that it actually should have less side effects, and there's lots of reasons for this, and it should have a better immune response. Now, what you're seeing in the studies, though, you're seeing a fantastic immune response, but you're seeing side effects pretty commonly, although, you know, how bad they are. Most, like a large number of people with this particular virus get a low-grade headache for a day or two. And if you compare it to other vaccines, I can say, well, that's annoying to me. So that means that we can't give all of our ICU staff that in one day, because how many of them are going to have a headache and need to take a day off or something like that? So there's that. But the other thing is that typically if you have any kind of a side effect to a vaccination, whether it's a sore bump on your arm or feeling crummy, it's related to a better immune response. That means your body is really making a much stronger immune response. So it's a trade-off. People having more likely to have some minor side effects is bothersome, but it suggests to me that we're going to have a better immune response. You don't know until they finish off or start closing off some of these large trials. What you really need to know is not what the blood test shows for immunity, is whether it's actually decreased the patient's chance of getting, COVID. So we won't know that for a while. I'm hopeful, based on everything that I've read, that it will be effective, but we don't know. It's almost certainly should be more effective than the flu shot, which is a little bit of hit or miss. Sometimes it's 70% effective and sometimes it's 30% effective. If we can get anywhere close to 70%, I'll be very happy. That it decreases your risk of getting it by 70% would be good and make you feel good about us getting ahead of this thing.
Any other questions today? Well, then I think we want to thank Dr. Myers for your time and your wisdom and everything you've shared with us. We really appreciate just everything you're doing in our community right now. You're a voice of reason, and we're grateful that you're joining us today.
Thank
Thanks
you.
for having me. Everybody stay safe.